Hey everyone, Ryan here, and welcome back to this last video in the patient management series. So first off, I just want to say thank you. I'm super excited to have a brand new logo, a new mascot, and some new merchandise. So there's some big things coming to Mental Dental this year, and it's all thanks to you guys. So seriously, thank you so much for all of your support. All right, so we're going to cover a lot of stuff in this video. Like always, I'm going to focus on the high yield things because let's be honest, we could have a discussion on insurance terms, payment plans, fraud terms, and United States healthcare for days and probably even weeks. But let's focus on the highlights for the board exam. All right, so we're going to start by talking about some insurance terms. And there's some semantics here. Many people will argue that there's no such thing as dental insurance, and it's really just a dental benefits plan. But for the purpose of this video, we're going to talk about these terms under the umbrella of insurance. Now, when I think of insurance, I think of a lot of complicated language that I honestly don't really understand. So again, I'm going to distill these things down to the most basic definitions possible. So first we have the beneficiary, which is fancy language for saying the person with the insurance plan. So let's say that's you and I. The benefactor is the insurance company, and the benefits are what the insurance pays for dental services covered under that contract that the beneficiary has with the benefactor. So we can group those three things together. Now, the premium is your monthly amount that you have to pay to have insurance. So think of it like a gym membership. So this might be $25 a month you have to pay in order to have your insurance active. So we'll say that's $25 a month. The copayment is a fixed dollar amount, a predetermined rate that the beneficiary under a certain dental plan is required to pay at the time of service. So an example of a copay would be, let's say $10. That's a pretty typical copay for seeing a doctor at their office. And you could pay more than this, say like $250 for an emergency room visit, etc. This would be something you pay when you walk in and you're seen by the doctor. All right, the deductible is a dollar amount that each beneficiary must pay before the insurance starts kicking in and the insurance company starts paying its benefits. So in general, if you have a, let's say, $1,000 deductible, you must pay $1,000 out of pocket, which means cash, credit card, check, it's literally coming out of your pocket, before your insurer or the benefactor starts covering a higher portion of the costs. So this deductible, unfortunately for us, resets every single year. Next we have coinsurance, and this is the percentage of the cost that you must pay, with the rest being paid by your insurance plan. So if you have, let's say, 20% coinsurance, and your deductible has already been met, so you've already put $1,000 towards your medical charges, that means you would pay 20% of each dental bill, and your dental insurance will cover the remaining 80%. And finally, we have out-of-pocket maximum, which is the most you'd have to pay in one calendar year out of pocket. So for your healthcare, before insurance covers 100% of the bill. So again, it's the most you'd have to pay in 1 year out of your own pocket before the insurance kicks in and starts to cover 100% of that dental bill. So this is how it works if you pick doctors and dentists who accept that particular insurance plan, and that's called an in-network provider. Otherwise, if they don't accept your insurance, they're out of network, and bills will typically be more expensive because you're not having these sorts of things help you out. All right, so third-party payers in this context are the insurance companies. These are Delta Dental, MetLife, etc. Because the first party is you, the patient, and the second party is the dentist or the provider. And the third party is the insurance, who negotiates the payments between the first two. So here are some terms to know in this third-party lingo. So we have usual, customary, and reasonable, or UCR for short. And this refers to a reasonable fee for a given procedure based on the geographic location of the provider. So an insurance will typically cover most of the fee if it's regarded as usual, customary, and reasonable. A table of allowances lists the maximum amount that a plan will pay for each procedure. So if a dentist charges $125 for a filling and the table of allowances lists that procedure at $100, the patient's responsible for paying the difference. So in this arrangement, the insurance will cover most of the cost, but it does allow the dentist to charge just a little bit more. And finally, we have the fee schedule, which is just a list of fees that the dentist has agreed upon for dental services, and the insurance has agreed to cover that in full. All right, next we have payment plans. I told you it's a lot of definitions, but we can get through it. So this is talking about how the dentist gets paid by the patient or reimbursed by the insurance company. So a fee-for-service payment plan means the dentist is paid per procedure. They get compensation based on an amount per procedure or service. So this would be they get $100 for a filling, $50 for an exam, whatever that fee is, that's how much they get. And it's the leading payer for dental treatment. Now, capitation plan refers to a different sort of arrangement, and this has to do with an HMO, which we'll talk about a little bit later in the video. So a dentist under this plan is paid on a per capita basis. Per capita basis. And this is based on how many patients they see, not on how many procedures they do. And there's also a ceiling or a cap on how the dentist is paid. And it's nice and easy to remember some of these things because it has to do with the name capitation. Now, under this plan, it's a little bit interesting because if the value of the service that the dentist is doing exceeds the payment that they get, then the dentist actually loses money compared to the fee-for-service model. But if the payment they get exceeds the value of the services they supply, the dentist gains financially compared to a fee-for-service model. So for whatever reason, the board examiners like to test on this concept right here, hence why it's in red text. And so I would definitely know some of just this basic concept of the capitation plan, how they're paid based on how many people they see, not on what procedures they're doing, and how that can relate to if they lose or gain money compared to the fee-for-service model. We have a couple other fee plans and payment plan structures. The sliding scale fee means that the cost of treatment is adjusted based on patient income and their ability to pay. So the patient has to bring in a whole bunch of documents to the dental office to demonstrate their income level and tax bracket and so on. So if they're in sliding scale A, they pay this much, sliding scale B, they pay this much, and it goes on like that. Balanced billing means the dentist charges the patient the difference between that dentist's reasonable fee, their UCR, and what the insurance plan agreed to pay. So even after you paid your deductible, your copay, your coinsurance, you've paid all that, and say there's still a balance on your account, that means you'd have to be responsible for paying that remaining balance. So balance billing, depending on what model you're practicing in, this is something that you don't often see, but sometimes it can be part of the arrangement. So that's something to look out for. And lastly, we have the prospective reimbursement, which means that the dentist is paid some predetermined fixed amount before the treatment is actually provided. And this is something that we see with federally qualified health centers, and we'll talk about those a little bit later in the video as well. All right, next we have some fraud terms. And these are super important for the board exam. I see these come up on questions all the time. So we'll definitely spend some time going through the definitions and then going through some examples so you can really digest and understand the concepts here. So unbundling refers to the separating of a dental procedure into its component parts. So let's say the dentist sends in an insurance claim for a 9210, that's local anesthesia, a 9430, an office visit, a 2140, which is a one-surface amalgam, and a 3120, which is indirect pulp cap. When just the code 2140 for the amalgam is sufficient and the only one that they should have been reporting in this case. So in this situation, the dentist is lying essentially and not being honest in what they're reporting and committing fraud. Bundling is just the opposite. So on the insurance carrier end, it's the systematic combining of distinct dental procedures. So let's say the dentist charges separately for a core buildup and a crown, which is the proper protocol. But the insurance company says that the core buildup is actually part of the crown and only the crown is going to be covered. Well, wait a minute. In this situation, now the insurance company is committing the fraud. All right, next let's go to upcoding. So this is reporting a more complex or higher cost procedure than was actually performed. So it's similar to unbundling, but there's an important distinction here. So here the dentist would say they did a full root canal treatment, let's say, but they actually only did a pulpotomy. So again, here the dentist is lying about what they did and committing fraud. So this is on the dentist. And then downcoding is just the opposite. So this is where a third-party payer changes the procedure code from a complicated higher cost procedure to a less complex or lower cost procedure than what was reported by the dentist. So a good example here is a dentist who did a 3-surface composite and the insurance turned it into a 1-surface composite. So this again is on the insurance company end and they're the ones committing fraud. And lastly, overbilling incorporates any situation where you're charging more than legally or ethically acceptable. So this scenario is a bit more nuanced. Let's say the dentist charges $500 for a new crown, but the insurance company only covers $400. So the dentist waives the copayment of $100 for the patient, but still tells the insurance that they charged $500 for the crown. Now you might be thinking, well, didn't the dentist just lose $100 for this arrangement? Because now the patient hasn't paid the copayment and the insurance company is only going to pay $400 of that $500. Yes, that's true, but this way the patient is very motivated to go ahead and get the crown because they didn't have to pay anything out of their pocket and the dentist still gets the bulk of the reimbursement, and now the insurance company was being lied to about how much they actually paid, which can go back and cause some problems down the road. So in this case, the dentist was lying about what was charged to the patient, and although it didn't really benefit them that much in the end, again, it's still fraud. They're lying about what was done, and this is a nuanced version of overbilling. Of course, a dentist can do this more outright and just charge the patient more money. All right, so now let's talk about United States healthcare. This is a huge, huge topic. And this is not a comprehensive list by any means, but it's a great overview for you to know. So feel free to take a screenshot of this for your reference for the remainder of the video. And I will say some of this stuff gets really complex. So again, I'm going to stick on the bare basics because luckily you don't need to know the crazy details for the board exam. So let's talk about managed care first, and then we'll talk about some government health programs to finish off the video. All right, so first let's talk about the HMO, the Health Maintenance Organization. Now, a health maintenance organization is a prepaid health plan and one possible private insurance option for health or dental insurance coverage. So an HMO is made up of a group of medical insurance providers that limit coverage to medical care provided through doctors and other providers who are under contract with that HMO. So there are these massive insurance companies like Cigna and Anthem, and there are doctors who are Cigna providers, Anthem providers, etc., who work only within that given plan. So these doctors are paid on a capitation plan for their compensation, which we talked about before is based on a per capita basis, how many people they're seeing, not necessarily what procedures they're doing. Next, the PPO, or Preferred Provider Organization, is a subscription-based health plan in the managed care world. So PPO is made up of healthcare providers that contract with an employer, an insurance company, or other third party to provide healthcare services at a discounted rate. So this panel of providers agree to accept less than usual fees in exchange for a higher volume of patients, since subscribers to this plan have a financial incentive to use providers from this panel. So if we're comparing HMO and PPO, the big picture idea is that an HMO has lower premiums, but it's more strict about what providers you can see, whereas the PPO, you have to pay a higher premium per month or per year, but for more flexibility and a greater choice of providers. So the last thing I'll talk about with managed care is that we have an open panel arrangement and a closed panel arrangement. So open panel is this type of dental benefits plan allows covered patients to receive care from any dentist and allows any dentist to participate in it. So any dentist may accept or refuse to treat patients enrolled in an open panel plan. And open panel plans often are described as freedom of choice plans, whereas a closed panel health plan refers to a dental benefits plan involving salaried dentists. So only patients who are members of that HMO or PPO can see these dentists to receive benefits. And likewise, these dentists can only see those patients enrolled in that plan. So open panel, you can see anyone. Closed panel, you can only see patients, dentists in that plan. All right, and lastly, let's go through a bunch of government agencies that monitor and have to do with United States healthcare. So we're going to start with the big one, Department of Health and Human Services, or the HHS. This is the principal agency of the U.S. government for protecting the health of all Americans. Now, important for the board exam here, suspected elder abuse must be reported to this agency. So you're calling in to the HHS. And elder abuse is it's a really sad issue, honestly. It's unfortunately very underreported. So if you suspect you are working with an elder abuse victim, you would call the HHS and let them know. So that does come up on the board exam, who you would contact. The answer is HHS. Now, all of the remaining agencies we talk about in this video, I think there are less than 10, they're all operating divisions of the HHS. So these are going to be all agencies as part of the HHS. So first we have the Administration for Children and Families, or the ACF. This one is involved with Head Start, which provides comprehensive early childhood education, health, nutrition, and patient involvement services to low-income children and their families. The Centers for Medicare and Medicaid Services is a massive branch of the HHS, and there's a lot of things going on here. So the CMS, again, is within the HHS and administers the Medicare program and works in partnership with state governments to administer Medicaid, CHIP, and also governs the Health Insurance Portability and Accountability Act, or HIPAA. So HIPAA is concerned with the privacy and security of protected health information, or PHI, of all patients. Medicare is for the elderly. Remember E and E. It's a really good way to keep everything straight here. So Medicare does not cover dental care. It's really, really important. Nice high yield fact for the board exam. So Medicare is available to the elderly, patients 65 and older, and also for patients less than 65 with certain disabilities and other conditions. But again, remember E and E for this. Medicare covers roughly 43 million Americans, and while it doesn't cover routine dental care, the exception is if the dental need is related to some medical condition like extractions that need to be done before radiation therapy for cancer. Now, Medicaid is a joint federal and state program for people with very low income, and in some cases also disabled and elderly. So this time, remember D and D for destitute, meaning someone who is poor. So Medicaid covers roughly 55 million Americans, and it involves a couple other things to note here. The early periodic screening, diagnostic, and treatment, wow, that's a mouthful, requires states to take action to ensure children under 21 can access care, and the Affordable Care Act, or ACA, known colloquially as Obamacare, expanded Medicaid coverage as part of it. And lastly, we have CHIP, and this time remember C for C, and CHIP actually stands for Children's Health Insurance Program, and this is another joint federal and state program that services 8 million children whose family's income are too high to qualify for Medicaid, but too low to afford private insurance. So this is the consumer-driven insurance and also that managed care like HMO and PPO that we talked about before. So again, big branch, the CMS, as part of the HHS. All right, next we have the Health Resources and Services Administration, or HRSA. So this one involves the National Health Service Corps, which provides loan repayment for health professionals who work in underserved communities. So essentially, they provide loan repayment and award scholarships to dental students in return for a commitment to provide care in underserved communities. This is low income, uninsured, rural, urban, etc. And so FQHCs, federally qualified health centers, are part of this movement. The Ryan White Care Act is also part of HRSA, and this funds medical and dental care for people who have HIV or AIDS. All right, number 4 is the Centers for Disease Control and Prevention, or the CDC. It's another really big branch. I'm sure you've heard of it to some degree, and it provides oral health surveillance, dental infection control, community water fluoridation. We talked about that a lot in one of our previous videos, cancer and tobacco-related issues, and support for state oral health programs. So the CDC is all about community level epidemiology, disease prevention, and health awareness. Number 5 is the FDA, the Food and Drug Administration, which is also part of the HHS, and I'm sure you've heard of this one as well. The FDA evaluates food and drugs, of course, and also medical devices based on their efficacy and safety. So if there is an adverse reaction to a certain medication in your dental office, you would notify the FDA. The IHS is number 6. This is the Indian Health Service, and this improves the health status of American Indians and Alaska Natives. Number 7 is the National Institutes of Health, and this organization or agency focuses on biomedical and public health research. And our last one, number 8, is the Agency for Healthcare Research and Quality. And so this one focuses on quality and access to care research. So some of the things it might look at in terms of quality are quality assessment, which measures the quality of care at a given location, and quality assurance, which not only measures what quality assessment does, but also implements necessary changes to improve that certain situation. All right, so that's it for this video, guys. Thank you so much for watching, and I hope you enjoyed this informative series on patient management. So if you're interested in supporting my channel, please check out my Patreon page. A huge thank you to Michael Raja, Reb Boyd, Leonilla Bunger, David Jaden, Yanit, Nicole, Isabella Caldis, Ali Benjdeer, Jacob K, and all of my patrons for their support. You can unlock extras like access to my video slides to take notes on and practice questions for the board exams. So go check that out. The link is in the description. And of course, stay tuned for our next video with a bunch of practice questions on the patient management series. Hopefully I'll have that out in just a few days. So thanks again for watching, everyone. I'll see you in that next video.